All right, let's go over our last one, which is the hazmat. We're going to go over hazmat stuff. And then that'll be it for this mod 5. And then I'm going to do a separate final exam review, and I'll pull up that final exam review document that's right here. I'll pull this up and do that separate, okay? Because it's a little bit of everything. But I wanted to go over these because these are very, very specific to your Module 5 information, okay? And remember, all of our module exams have been, what's the word? Cumulative, right? All of our exams, module exams have been cumulative. So that also means that mod 5 is cumulative of everything that we've done over the semester. You still only have a 50 question test, but it can cover anything, of course, with the core content of it being this operation stuff. So let's talk about hazmat real quick. Okay. Hazmat or hazardous materials, you have some different things, right? You have some different basically forms of it. Okay. Forms of hazmat. TRACEM, TRACEM. T is your thermal. This is going to be hazardous, sources from heat, burning, radiant heat that might come off of something, but you've got your thermal hazards. R stands for radiological, like your nuclear fuels and byproducts, nuclear bombs, things like that. A stands for asphyxiation. This is going to be the lack of oxygen due to chemical vapors and heavy gases. Okay, so these are things that happen with asphyxiation. C is chemical, maybe your toxic or corrosive chemicals. E is going to be etiological, like your biological hazards. Okay, everything doesn't have to be chemical. It could be biological also, right? And M stands for mechanical, trauma that occurs from bullets, shrapnel, things like that. Okay, so that is going to be just an acronym that we use in our hazardous materials when we're talking about. Number 2, what are shipping papers? So I don't know how much you guys actually pay attention to some of the vehicles, that are on the highway with you when you're driving down that highway. But there's a lot of trucks, a lot of tanker trucks that are carrying substances that are hazardous, right? And so whenever hazardous materials are being transported from one place to another, it is required by law, by the Department of Transportation, that they have what's called shipping papers, okay? And this will identify exactly what the substance is, the quantity of how much is being shipped, the origin, and the destination, okay? This is something that should be on every vehicle that's transporting hazardous materials, okay? It's very possible that like the I-20 corridor, I-20 is a pretty common place for hazardous materials to be shipped from one place to another. Sometimes a lot of times they like to do it like in the middle of the night, when there's not a whole lot of traffic, but sometimes they shut down parts of the highway depending upon whatever substance it is that they are transporting, okay, just for the safety of everybody. But they're going to have these shipping papers. Again, it is by law, and it identifies what the substance is, how much they have, and where they started and where they're going to, the origin and the destination. Now, the NFPA 704 system, okay, this is actually pretty cool. Okay, well, actually, before I get to that, I'm so sorry. Before I get to that, I want to talk about the little orange books that you have in your bags over on the left-hand side. I don't know. I'm sure you guys have seen it. You'll have probably opened that left-hand pouch multiple times and seen this little orange book and been like, I have no idea what that is. Okay, but it helps with the placards. Okay. So this is our ERG, our Emergency Response Guidebook, U.S. Department of Transportation Emergency Response Guidebook, okay? And let me pull up a little picture of this. Okay, that's what these are, all right? And so you're looking at this and you're going, oh yeah, I know, I've seen that in there. You're right. Okay. So you have little little pocket size ones. You have big ones, you know, in these spiral notebooks. But basically what's going on is there's a placard system that every US DOT placards, here we go. You see how many times I pulled all this stuff up. There's a placard system that you know, has to be on these vehicles, on these tanker, you know, trucks that are transporting these substances. Not only do they have to have the papers, but they have to have the placards, and all of these placards mean something. All of these numbers mean something. And when when you get on scene of a hazardous material spill or an accident that's involving one of these tankers, you have no idea what that is. And that's what that little book is for. That book goes through all of this and it tells you what all these numbers are. What does this mean? Okay. So when you're looking at these there's 9 different classes. Okay. And I really want you to kind of pay attention to this stuff now that you know about it. If you've already been paying attention to it, great. But you're going to start noticing this on a lot of, you know, trucks that are driving down the road. But you've got your explosives, you've got your flammable gases, non-flammable, your oxygen, right? Combustible liquids, poisons, toxins, corrosives, radioactive materials. These are all different classes, and all of their placards look different. Okay, they all look different, and they have different numbers on them in different parts of the diamond. They have different numbers in the middle, right? Look at this one. You know, you've got, this is, oh gosh, it's number 9. I know that. But it's got this number and, you know, number 9 down at the bottom. This is our flammable, number 3. This is also flammable, number 3, but it looks different. You see how we've got a white bottom of the diamond and a red bottom of the diamond. They're all different. And if you don't know what all this stuff is, which there's no way to memorize all of this, that's when we use that little book. Okay, that's when we use that book. So we open up that book and it tells you a little bit about what's going on with, you know, what it is, what is that substance, what is going on with the thing that's being transported. Okay, it's pretty cool. Okay, so that's what that is. But now I want to talk about the NFPA 704 system, okay, which is your question number 3 on that worksheet. So NFPA stands for the National Fire Protection Agency, okay, and they have their own placard system as well. So NFPA 704 placards, okay. Now these placards are on fixed storage containers, okay. The other ones that we just talked about, those are mobile, okay. So those are mobile on mobile vehicles, transporting substances from one point to the other. This placard system is different. This is going to be on your storage containers where they're being stored. And it is a diamond, and each diamond actually has 4 different colors. Okay, you've got your blue, your red, your yellow, and your white. These different diamonds, these different colors mean different things. Okay, obviously red is your fire hazard, you know, pretty simple. Blue is your health hazard, yellow is the reactivity, and the white is going to be something that's specific about that substance. So when we're looking at, let's look at the blue first, the health hazard, okay? The lower the number, the less hazardous it is. So the higher the number, the more hazardous. So 0 is normal, 1 is slightly, 2 is hazardous, 3 is extremely, and 4 is deadly. This is for your health. Fire is talking about, you know, the flash point. When do they ignite is really what it is. And again, the lower the number, the less hazardous it is. So if you have a 1, then that means that this substance is not going to ignite unless the heat or the temperature is above 200 degrees Fahrenheit. And it's going to get all the way up to number 4, which is it can ignite if the ambient temperature is below 73. So that's pretty bad, right? The reactivity, you know, how stable is this? Again, the lowest, or 0, is it stable, all the way up to it's going to go off. Number 3, it may detonate with heat. 2, it's violence with heat. or 4, it may detonate just because, right? And then your white is your specific hazards, whether it's corrosive, whether it's something that we do not want to add water to, right? It's an oxidizer, things like that. But this NFPA diamond or placard diamond is specifically for marked storage containers that are not mobile, okay? So, like that, take a look at that, right? Okay, so this is what it is. We've got a health hazard of 3, fire is 0, reactivity is 0, so it's more of a health hazard than anything else. And then SA, I'm going to be honest, I would have to look that up because I don't know this stuff off the top of my head. So I would need some kind of, just like a lot of people, a book or some kind of document that kind of walks through what that stuff is, right? Let's see if SA is on here. It's not. So anyway. So it's very interesting to know this. And I know that the National Registry has asked about this stuff before, has asked about the diamonds before, the placard system. SA, simple asphyxiants. There you go. That's what SA is. Okay. All right. There's that. Let's talk about the MSDS sheets. MSDS, these are your material safety data sheets. This is going to provide basic information about the chemical makeup of a substance, the potential hazards that it presents, appropriate first aid in the event of exposure, and other data. I think there are 16 different sections on these safety data sheets for every material, okay? We want, and it's to ensure the safe handling of the substance is really what it is, okay? Where I used to work, over at the mechanics area, they had MSDS sheets on a lot of the things that they used, So if you go to a mechanics shop, they're going to have safety data sheets on a lot of the substances that they use, a lot of the liquids and substances that you use in a vehicle. You need to know about it. Potential hazards. What do you do in the event of an exposure? Things like that. Okay. It has to be on the original container that it came in. If that substance is transferred to a secondary container, then that also has to have its own, or it's a printed label for the MSDS. Okay. So just keep that in mind. Any kind of substance, potentially hazardous substance, has to have information to keep you safe. Okay. Now let's talk about an actual hazardous materials scene, because you're going to have different zones, different hazmat zones. You're cold, you're warm, and you're hot. Okay. The cold is obviously the furthest away from the spill, if you will. The hot is going to be the area immediately surrounding the release of the substance. So let's pull up a picture, and it's going to definitely help us kind of figure this out. Okay. Hazmat zones. All right. So let's take a look at this. All right. So let's just start with the hot zone. Hot zone is going to be the center. Okay, and like I said, that's going to be the area immediately surrounding the substance release. This is the most contaminated area. Okay, access to this area is strictly restricted, very restricted, to only those with specialized training. You as an EMT will never, ever, ever find yourself in the hot zone. Okay, that's not where you go at all. The warm zone is the area around the hot zone. That's your warm zone. This is kind of considered our transition zone, okay? Because we're going to be transitioning in and out of that hot zone, from the cold into the hot. This is where decon takes place, okay? So any patient that is in the hot zone, you're going to have your specialized, specially trained hazmat providers go in there with their, I can't talk. With their hazmat suits and, special safety, get those patients, transition them, but they're not just going to bring them to your ambulance, okay? They have to decon them first and make sure that it's safe for them to give them over to you, Okay. Decontamination will occur in that warm zone, and also life-saving emergency care can happen in that warm zone. Okay. Again, the warm zone, very similar to the hot zone as far as minimal personnel, and they have to have very specific training. The cold zone is going to be your safe space. Okay. This is a safe area where no specific protective clothing is needed. You don't have to have specific training because you're not near the release, right? This is where treatment will occur after decon. This is also where triage, treatment, transport, and rehab will occur. You, with your ambulance, you will be in the cold zone. Okay, you will be in the cold zone. Let me see if I can get another. Let's see here. This is a good picture. This is actually a really good picture. Okay, so hot zone is the immediately surround, or the area immediately surrounding the release, right? Here's your warm zone. Here's your hazmat team. They're going to be in the warm zone. They're going to be going in and out, but this is also where we're going to have decon, and this is kind of the transition for them to bring your patients, decon them, do any life-saving treatment, and bring them out to the cold zone where the other first responders are. Now, wind direction is super important, okay? The wind direction, we always want to be upwind, okay? So remember, the direction of travel, when we were talking about our traffic, the direction of travel is going to be this way, and we want to be upwind. I don't want to be downwind from a substance release and all the toxins and everything that's happening from that. You don't want to do that. You want to be upwind. You also want to be uphill. Okay, if it's on a hill or anything like that, you don't want it. You don't want to be downhill to where the substance will actually, move and travel and get to you, right? You don't want that. So you want to be upwind and uphill of a hazardous material. Okay, on a traffic accident, you will be downstream of the action area if you're the second arriving apparatus. Okay, so don't get those confused. All right. What are the risks with clandestine labs or clandestine labs? So basically, those are secret or concealed labs that we don't know that they're there. Okay, if it's a house where they're cooking meth, right? And we don't know that they're there. That's the risk, is we don't know. Okay, this is where they're preparing synthetic drugs, something of that sort. And scene safety is the most important key to this, because unfortunately, that's the risk. We can't keep ourselves safe from something that we don't know about, right? There's a couple other things like contamination of the soil and water and the air that's close to the site of the lab. Maybe there's improper storage of those synthetic drugs or synthetic materials that they're producing. Improper disposal of chemicals and waste. There's toxic gases. So there's a lot of safety issues around that. But the risk is that we don't know about it because it's a secret lab, right? Now, CBRNE, this is another acronym that we use specifically for hazmat, right? You've got your chemical, biological, radiological, nuclear, and explosives, right? These are going to be our weapons of mass destruction. Okay, weapons of mass destruction. Let's see here. The key piece for an EMT, we never attempt a rescue in a hazmat situation unless you have specialized training and specialized equipment. That's the key piece. We don't teach you guys that in EMT school. We just teach you the general properties of what's going on with this, and again, where you need to be, which I just told you. You guys need to be in the cold zone. I don't give you specialized training for hazmat. That's going to happen. That's a totally different class. That happens after you're hired on with a fire department, and only if you want to go into that special, that specialized training. Okay, but you must request help. So that scene size up, when we're talking about patient assessment, that scene size up is key, because when we're requesting additional resources, you're requesting very specific resources, right? Let me get back on this tab here. Sorry. You're requesting very, very specific resources for your hazmat. Okay. You want to locate yourself and bystanders, like we said, uphill, upwind, away from the danger. Always away and up. Okay. Looking at a couple more things, some chemical agents. You've got your nerve agents, your cyanide, your tear gas. We're just going to go through this a little, just real quick. Nerve agents, these block the enzymes in your nervous system, and it causes your organs to become overstimulated and basically burn out. You're going to have sludge symptoms, which is actually number 8 down here. Sludge stands for salivation, lacrimation, urination, diarrhea or defecation, gastrointestinal upset, and emesis. So basically, any way that you can lose fluid from your body, you will. Okay. And that's what happens with these nerve agents, because when we say the organs become overstimulated, they are just constantly hitting that receptor, and you're losing all of this. Okay. Organophosphates is definitely a form of nerve agent. So what do we do for this, right? What's the treatment for that? Well, first off, scene safety, like we talked about before, decon has to occur, decontamination has to occur, and then after decon, you treat them aggressively with ABC management. This is airway and ventilatory support. You're probably going to be bagging this patient, and there is something that you might be able to give depending upon if your agency carries it, and it's called a duodote. It's an auto injector. It's very similar to an EpiPen, but it's called a duodote. And this guy has both 2-PAM and atropine in there. The 2-PAM is going to help with the nerve agents that are constantly hitting your receptors. Okay, it's just gonna help with that and make it stop. And the atropine is going to help to dry up the secretions that you have from the sludge symptoms. But here's the bad thing about a duodote. We always talk about side effects of our pharmacology. Well, the side effects of a duodote are pretty bad. But if you really think about it, this nerve agent is pretty bad too, and you have to fight bad with bad. So if you find yourself in and amongst, a hazmat spill or something like that, where there's nerve agents involved, and you're using that duodote, you're already hurting pretty bad. But your duodote is pretty much the only thing that's going to help you. Okay. And that's why we talk about scene safety and situational awareness is so, so important. Now, cyanide, remember, is a colorless gas, has an odor that's very similar to almonds. We talk about bitter almonds. Cyanide is going to bind with your body's cells, and it prevents oxygen from being used. Okay. So the treatment for that is decon. Okay, again, decon. Whether it's and it's not just on the patient's skin, but in their clothes also, because you can have off gassing of the cyanide gases from their clothing, right? So you want that patient to be completely deconned, and then we're going to support their ABCs, use a BVM, give them some high flow oxygen, and transport. Okay, tear gas could be short term, could be long term, but it's going to be given some effects on your respiratory system. Eye injuries, okay, mouth and throat irritation, again, decon. Treatment is decon and ABCs. Pneumonia-like agents, this is going to be from your bacteria, like your anthrax, your pneumonic plague, your ricin, things like that. This is going to be your bacterial agents. ABCs, ventilatory support, that those patients, a lot of times when they get to the hospital, they're going to be getting antibiotics, okay? But again, decon, make sure that you're safe. Encephalitis-like agents, those are going to be kind of your enterovirus, your virus agents. And remember, the pneumonia and encephalitis, Those are your biologic agents, right? We've got our chemical agents, our biologic agents. Treatment for that, for an EMT, ABCs and transport. Botulinum, this is actually the most potent neurotoxin that's in existence. It affects the nervous system and eventually causes muscular paralysis from the head down the entire body. Your accessory muscles and your diaphragm are paralyzed, and so you're unable to breathe. So how do you think we treat that patient? ABCs and ventilate, right? After decon. So all this stuff is, we got to decon our patients and aggressively support those ABCs. That's really the treatment for all of this as far as an EMT is concerned. Okay. We talked about sludge. Okay, just make sure you can kind of rattle that off and you understand what's going on with this. This is from your nerve agents, right? This is your salivation, lacrimation, urination, diarrhea or defecation, gastrointestinal upset, and emesis. Okay, from your organophosphate poisonings or your nerve agents. Number 9, what are the 3 mechanisms of death associated with nuclear weapons? So nuclear weapons, the 3 things, we've got the blast, that explosive blast, and we'll review blast injuries in just a moment. But the first one is the blast, okay? The second is the thermal radiation, the heat that comes off the blast. 35% of the blast is heat. It can cause fires. It's gonna burn you and your patients, okay? And then the third one is the radiation, the ionizing radiation that's emitted in forms of rays and particles and that kind of stuff from the nuclear weapons. Those are the 3 mechanisms, okay? Just as a review, our blast injuries, remember you had your primary, your secondary, and your tertiary blast injuries, okay? And if the first mechanism of death from a nuclear weapon is the blast itself, then just remember those 3 phases of your blast injuries. The primary is from, again, the blast itself. The secondary is going to be from any objects or flying objects that strike you from the blast. And then the third is when you are thrown against a stationary object, right? So just make sure you're good with those blast injuries. And number 10, what is the role of EMS during an active shooter or an active threat? So this has kind of evolved over several years, well, probably about, I don't know, maybe in the last 10 years or so, it's really started evolving and it's getting really good. Okay. Cause it used to be that we really didn't have, much to do with that. It was just cops would get on scene and it was a little bit of craziness. When there was no organization to things, or the organization wasn't what it needed to be. How about that? Okay. But our role during an active shooter or an active threat, our role is to do treatment and transport. Okay. It's very, very likely that you as an EMT will not be entering the scene. The patients will be brought out to you. So you're probably not going to be the person going in to do triage on an active shooter event, okay? But you'll be in the treatment area waiting for them to be brought to you. Or you'll be in the transport area waiting to transport those patients, right? They do have, any time that there's an active shooter or an active threat that's still going on, then there is a team. It's called oh gosh, I forgot. I used to know, but it's a unified team between police and fire. And this only occurs after unified command has occurred, right? Because fire is going to get on scene and police are going to be there already. But your fire command and your police command have to get together, discuss, and basically form what's called a unified command, okay? And then they're going to form teams that will have both police officers and fire personnel or whoever is going into the scene for medical. And they're going to be small teams and they'll go in only as far as the officers will allow them to. And they'll do triage, just like we talked about with the start triage. They'll do triage, do a little bit of emergency care, controlling bleeding and things like that, and then continue on. Again, only as far as the officers of their team will allow them to go. If it's during, an active shooter threat. Okay. So you as the EMT will most likely not be a part of that team. And you'll be outside in the treatment or the transport area waiting to do your duties and responsibilities after the patients are brought out to you. So, okay, that deals with that. So those are all 4 of those little worksheets that are really great for this module 5. Okay. Remember, we've in module 4, we talked about moving patients and things like that, maybe do a little bit of a review for that. Remember when you use a scoop stretcher, things like that. But that's probably your best review for mod 5. Okay. Remember your consent, because that's super important. Mod 5 is all about operations and how we operate within, doing our EMS stuff. Okay. So I'm going to end there, and then I'll do a separate one in just a little bit about over that final exam review. So let me just go right back to where we were. Okay. Go to your module 5. There it is. Stop moving. There it is. Okay. So I will pull this up and I will go over this in a minute. Okay. We've got medical legal, and this is 30 pages long. Okay. And it's over a little bit of everything. Primary threats, right? Life threats, ABCs. What do we have? Okay. Your GCS is in here. Bradycardia versus tachycardia, your medical terminology, decamp BTLS, what's a sign versus a symptom, what's your sample, sympathetic versus parasympathetic, things from your mod 1. Then we go into respiratory. Then we're going to go into, our module 2, all of our different emergencies, cardiac, all this stuff. We'll go through all of this in a different review. Okay. So, and I will post that one as well. All right. If you guys have any questions, you know where to find me, and I'll start getting this final exam one out to you guys. Okay.